Imagine you're a doctor reviewing a patient's electronic health record. You see a few scattered notes, a prescription for an antibiotic on Monday, another on Wednesday, and a stop notification on Friday. As a human, you instantly connect the dots. You know this patient had a bacterial infection and was on a 5-day course of therapy. But for a computer, those aren't a story. They're just 3 isolated data points with timestamps. The actual clinical event, the therapy itself, is implicit. It's a high-level narrative hidden inside low-level data. This is the core challenge a new research framework called HEVA is designed to solve. The goal is to move AI beyond seeing simple data points and toward understanding clinical events. To achieve this, the researchers developed a logic-based system that categorizes events into 2 primary types, persistent and non-persistent. Think of a non-persistent event like a cough. This requires regular observations to stay active. If the data shows a cough on Monday and Tuesday, but then nothing for a month, the system doesn't assume the patient is still coughing. Instead, it uses a temporal window, essentially a timeout period, to determine when that event has officially ended. Persistent events work differently. Think of a chronic condition or a long-term medication. Once these are triggered, the system assumes they continue indefinitely, or persist, until it encounters a specific termination condition, such as a doctor's note explicitly stating the medication was stopped. Once the system can identify these basic events, it can stack them to create what the researchers call meta-events. For example, if the system detects a primary cancer episode and a specific targeted therapy happening simultaneously, it can infer a higher-level meta-event, such as targeted mutation therapy. However, medical data is notoriously messy. Sometimes the logic rules might suggest 2 different events that actually contradict each other. To resolve this, the researchers introduced confidence levels and a repair mechanism. If the AI finds 2 overlapping events that cannot both be true, it doesn't just crash or pick one at random. It evaluates the confidence levels of the triggers. For instance, one event might be triggered by a highly accurate diagnostic code, while the other is based on a vague clinical note. The system repairs the timeline by prioritizing the most reliable information. But how do we actually know if an AI can think like a doctor when analyzing these records? To find out, the team tested HEVA on real-world lung cancer data from over 300 patients, comparing the AI's results to the judgments of medical experts. Now, medical records aren't like a math problem, where there's one objectively right answer. They are often incomplete or open to interpretation. To measure performance, the team didn't just look for a simple yes or no. They broke every clinical event down into 4 key components. Did the event happen? What was the specific subtype? When did it start? And when did it end? By scoring these individual pieces, they found some fascinating trends. Across the board, humans and AI were highly aligned on whether an event happened. Like, does this patient have lung cancer? Because that is usually explicitly stated. But the agreement plummeted when it came to the dates. Specifically, the start date had the lowest agreement scores. This is because clinical records are often vague about exactly when a disease began, making it a guessing game even for the experts. The researchers also noted that the AI was significantly better at identifying primary lung cancer and common mutations, like EGFR, because those are well documented. It struggled more with secondary cancer episodes or specific therapies, which are often buried in scattered notes or inferred retrospectively. This leads us to the most important takeaway. When they compared HEVA's performance to the human experts, the AI's agreement rate was roughly 60%. At first glance, that sounds low. But when you look at the human-to-human agreement, it was also around 60%. The experts themselves only agreed with each other about 61% of the time, because defining the exact boundaries of a disease is incredibly subjective. This means HEVA is performing within the same range of variability as the doctors. It's making the same kinds of interpretations and mistakes that humans do. This is a massive win for the research. It proves that HEVA can emulate clinical reasoning using only structured data, without even having access to the full narrative reports that the doctors had. While it's being used for cancer research right now, the framework is generic. This means it could eventually be used to map out patient journeys for almost any medical condition, turning fragmented, low-level data into a clear, traceable, and human-aligned clinical history.